So our use of mathematical models can allow us to determine the epidemiological factors and demographic factors that impact the spread of diseases. So this can, in terms of our work on influenza, can be populations of livestock, movement networks, and in terms of humans, their population density, how often they visit live bird markets, how often farm premises are visited. By determining which factors are important in the spread of the disease, we can then outline potential control strategies to then combat the spread of infection. And these can range in a number of ways, either focusing on the livestock themselves through culling strategies or through movement restrictions. And on the human side, we can go to having isolation, so quarantined areas where people are not allowed to enter, or trying to use antiviral therapies. So for people that are infected, we try and then reduce their symptoms to reduce their risk of spreading infection. So in terms of influenza, we've seen in the recent outbreak in China of H7N9 that live bird markets seem to be associated with the spread of a number of cases and the spread of disease there. So the behaviours of the general public can play a massive role in terms of the size of the outbreak. In this case, China has introduced closure measures on some live bird markets to try and then reduce this source of infection. In terms of other control strategies, there might be cost implications and personnel limitations in terms of getting out veterinary workers to vaccinate animals or carry out culling if an infection has been located on a premises. So a difficulty with preventing influenza outbreaks is that influenza is able to infect a number of animal hosts. So in fact, it's wild birds who are the natural host for influenza, but there's also a number of strains that are circulating within poultry populations and pig populations. Therefore, human interactions with these species can occasionally lead to spillover transmission occurring. Influenza strains can be found in a number of different animal hosts. The natural hosts are wild birds, but there's also strains circulating within the poultry population and within swine populations. Interactions of humans with these hosts can lead to transmission occurring from the animals directly to humans. This can be particularly difficult to track down and prevent, with farm workers potentially having very close interactions with animals each day. Biocontrol measures such as disinfecting may not always be effective, so there's always a risk that transmission may occur. So a difficulty is trying to pinpoint the areas where it's most likely these spillover events, this transmission from animals to humans, is actually going to take place. With our modelling, we can try and pinpoint where these regions may be and therefore try and focus our control methods to potentially educate the local population to what measures they should do to minimise their risk, or if an outbreak does occur, then to be able to mobilise personnel to then carry out the control measure of choice, such as culling any infected livestock and introducing quarantine zones to try and stop people carrying out the infection to other regions of the country.